Hello, Elevation Health friends and family. I want to talk to you today about some of the highlights with what we covered at the workshop. Circling back, we had a lot of positive feedback and rave reviews and a lot of interest in what people learned. So I want to cover some important things and give you an opportunity to, again, take action and implement, not just get the information, but do something with it. So we talk about carrying around extra body weight and the extra baggage and all that it causes, especially obesity and being overweight. We learned that it diminishes pretty much every aspect of your health, from your reproductive and your respiratory function to your memory and your mood. The good news we learned, though, is that you lose as little as 5 to 10% of your body weight. It offers huge health benefits to people who are overweight or obese. Even if you never achieve your ideal weight, that's fine. You still get to benefit from that. A recent review of 89 studies on weight-related diseases showed that diabetes was at the top of the risk for being overweight or obese. Compared with men and women in the normal weight range, men with BMIs, that body mass index, over 30 or higher, were 7 times higher risk of developing type 2 diabetes. And women who are overweight or obese, actually the over 30 BMI being obese, had a 12 times higher risk of developing diabetes. So that's the number one concern. After that, we talked about cardiovascular disease and how being overweight and obese affects the heart and things like blood pressure, cholesterol, triglycerides. All of that increases along with your body weight. And these changes translate to an increased risk for coronary heart disease, also stroke, and also cardiovascular death. Studies show that being overweight creates a 32% higher risk of developing coronary artery disease. And being being obese has an 81% higher risk. That's because the fat cells generate something called cytokines, which is an inflammatory response. And the inflammation is what is really the direct contributor or the catalyst of coronary artery disease. We know that we learned at the workshop that it's not the cholesterol that causes coronary artery disease. It's what happens to the cholesterol. It's when the cholesterol becomes oxidized, and then through that process, there's inflammation, and that's what begins the process of closing the arteries. So immediately when you put on weight, that triggers that process of inflammation. So it's really important that we're aware of that, because women and men with BMIs over 30 or higher have more than a 50% higher risk of dying early from any type of cardiovascular disease. So again, the good news is that if you lose 5 to 10% of your body weight, it can lower your blood pressure, your cholesterol, your triglycerides, and automatically improve all cardiovascular risk factors. Not just with the cardiovascular concerns, but other things like cancer. We didn't talk about this at the workshop, but reviewing other studies, it pointed to convincing evidence of an association between obesity and cancers of the esophagus, the pancreas, colon, rectum, breast, kidney, and gallbladder cancer. Direct correlation with that. And depression also comes into the picture with being overweight and obese. Studies show that people who are obese were more likely to have depression than people with healthy weights. We did talk about changes in sexual function at the workshop. Now, sometimes this is a side effect from being on prescription medications, namely one of them would be blood pressure medications. There was a discussion there, but simply being overweight, studies show, are affected by obesity with the direct connection to decrease in sexual function. Data from recent studies indicate that the odds of developing erectile dysfunction increase with increasing BMI, body mass index. Again, with the World Health Organization, they show that when the BMI goes over 30, you're at the highest risk for heart disease, cancer, fatty liver disease, in addition to all these other things that we're talking about, depression, and all the other aspects of quality of life that we've been discussing. That's why that BMI is so important, that it be less than 30 and ideally closer to 24. and below. Being overweight also puts, as we all know, mechanical and metabolic strain on bones, muscles, and joints. Arthritis of the knee and hip are the most commonly associated with obesity, and obese patients account for 1/3 of all joint replacement operations. It also increases the risk of back pain, lower limb pain, and disability. So the bottom line is, lugging around all these extra pounds, it really affects every aspect of your health, as you learned today, and much of which we already know. Not to mention taking years off of your life. But it doesn't have to be a permanent condition. It's not a permanent condition. In many cases, we have a choice. And if you've never heard about the Elevation Health Ultimate Fat Loss System, then please stop what you're doing now and ask Deborah. Walk up to the front desk or click on the link below and make an appointment with Deborah, and she'll talk to you about how to get an appointment for your body composition analysis. Basically, you're going to stand on a special scale. You'll take your shoes and socks off, puts a low-level electrical impulse through your body, and then the scale and the program have a way of basically showing what your body mass index is. There's a special algorithm and program which differentiates body fat, muscle mass percentage, your water mass, as well as your metabolic age. And really the program that we have is least of all a weight loss program. The most important thing that we focus on is fat loss, making sure that your body is literally incinerating abnormal fat, which is tucked away in your abdomen, around your liver, around your gallbladder, around your heart. That's the most dangerous fat that affects your health the most. And the other part of the program is, most importantly, raising and resetting the metabolism so that the weight doesn't go back on. And if you don't do this, if you don't lose the fat and you don't raise the metabolism, then it's just like any other weight loss program. You go through it, you look good, you feel good temporarily, and then you put it back on. What makes our program different is that we use an objective evidence-based tool and outcome to measure the fact that we are actually changing your metabolism. And that's the most important thing, to get the hormones in balance, to change every aspect of your quality of life and decrease the risk of all these different diseases that we talked about. I'll give you an example. All right, so this is a picture of Jemima. How long ago was this?
That was last year.
Last year?
It was early last year, like around February.
Around February last year, and so we're in August right now. So now I'm gonna show you the real Jemima right now.
I'm still fat.
No, I would not say so. How many pounds have you lost? 75 pounds. And counting. Still going. Still going strong. So what was it that caused you to take up this journey?
Your lectures, even though that I wasn't able to attend as much as I wanted to, but I read your literature, and every now and then I get into the website, and I realized that I needed to take charge.
That's awesome. Well, I'm really proud of you. It takes a lot of discipline and courage, and this is a real inspiration for me, everybody here, the staff, the team, and all the patients as well.
And I want to tell you something else. Within 15 days, I will turn 60 years old. So
now that's a blessing. Yeah. As you get older, you get healthier.
Yes.
And you get prettier.
Thank you. Thank you, doctor. Thank you.
That's awesome. Thank you so much for sharing. Yes. God bless.
Hi, my name is Linda Tomlinson. I've been a patient of Dr. Yachter for probably about 3 years now. I initially came to him for chiropractic needs, and I went to a workshop and they were talking about a weight loss program. I normally don't try weight loss programs because everyone I've tried thus far never worked, but I decided to try it anyway. And I tell you, it was the best decision I've made for my health. I don't longer have to take the diabetic medication anymore. I lost the weight I wanted to lose, and I have kept it off for a couple of years now. Deborah is very knowledgeable. She will walk you through it. It's one of those things where it's a matter of life, because we want to be able to keep the weight off and eat healthy and live longer. basically. So I just want you guys, I'm going to suggest that you guys try it because it really worked. I've sent 4 people that I know there that have went through the program, the weight loss program, and they look wonderful. So just letting you know, I'm suggesting it. I put my life on it, and I did, and I got the best results. So you guys should try it. Just want to let you know, I'm grateful.
Wow. So yeah, just like Mike used to say, try it, you might like it. But these are real people with real results, and the most important thing is that the results are permanent. So as they were saying, you make your appointment with Deborah, and she'll discuss with you your health goals and see if you're a candidate for the program. Also, it's a really good time right now because they're running a special. It's a $100 discount off the cost of the program for your initial first round, if this is your first program, or if you're a returning patient and you're doing another round. Either way, but the offer expires on March 23rd. That's I guess next Wednesday, this coming Wednesday here, March 23rd. So please make sure that you click the link below or ask or call the office and make your appointment. So thank you for joining me today. I love and appreciate you. God bless.